Hi, my name is Dr. Sam Sunshine at OC Sports and Wellness, and today I'm joined by one of my patients, Glenn, and I decided to bring Glenn in today so that he can discuss and share with the audience some of the changes he's made with his lifestyle that have had profound effects. So Glenn's been a patient of mine for just under a year, maybe 9 months, and I thought he could pontificate on some of the lifestyle changes he's made that have had profound effects on his health.
Yeah, so thanks, Dr. Sunshine. And I guess I'll start by saying that I've always been into health and wellness my whole life. My parents were really into health and wellness, and so I knew what to do. And I know it's a journey, it's not just a destination, and always making adjustments. And I've read a number of authors that are into functional wellness, like Dr. Sunshine is. And one of them being Dr. Peter Attia and Dr. Hyman and Dr. Perlmutter. And so I'm always looking to improve because you're never, obviously, if you get comfortable, then you're going to be stagnant. And so when we first met last year, and it's actually been a year, I kind of took a step back and we did some measurements, and that would be VO2 max, weight, obviously, blood pressure, sleep, and I know we're both fans of Oura Ring, and so I felt like I was sleeping well, but my Oura scores were always lower. And so I started to do some things that would help improve the Oura score. Because once the Oura scores were in the 80s and sometimes 90s, the readiness scores would follow. And I know it's just a metric to kind of go by, but it also, if it does really tell you how you're feeling and how your underlying body chemistry is reacting. And so some of the things that I've done working with you are cutting out eating 2 hours before bed. It's simple things that we've all heard, but when you actually put them into play, they actually work. The other thing is not following social media and digital, having a digital sunset, if you will, and because your mind gets really clogged up with a lot of junk, especially over the past couple of weeks with the election and stuff. So that's really helped, and then reducing blue light in the house. And I'm using all these as a kind of a precursor to what really helped with my sleep. And then the other thing is keep the room dark. Stuff we've all heard, but it's sometimes you forget to do it. And really doing that on a regular basis. One of the main things is, I grew up liking to drink beer and alcohol. I gave up alcohol about 6 months ago. And I think that's one of the biggest game changers, because sleep was my number one priority to make everything else kind of work well. And so giving up alcohol, which is not the most, and when I talk to people, because they ask what I'm doing to keep in great shape, I say, well, number one, give up alcohol. Number two, focus on eating 80% of all your food, whole foods. So if it's got more than one ingredient, you got to get away from it. Stay on the outside of the grocery store aisle. And you can, it's about moderation. So if you're 20%, you're having a protein bar, you're having, you go to a restaurant, getting over infatuated with the process is going to drive you crazy. Because I've been there. I counted calories. I counted macros. I've thrown all that out the window. And I our last discussion, we were going over my lab panels. I have not tried to lose weight. I have not tried to lower my body fat. I've not tried to do any of this. It's just kind of focusing on the daily processes of some of the things we've already talked about. And the results will come. And don't focus on the results. Focus on what you're doing on a daily basis, and it's going to come. And if you make mistakes, that's okay. You just get back on the train. Don't beat yourself up. People are like, well, I had a pastry and I did this. That's okay. You had a drink. That's fine. If that's what brings you joy, then do it. But don't continually do it. And it's a very simple message, but it's hard for a lot of people to accept that. Just for example, since we left, I think I saw you maybe 6 to 8 months ago. I was about 15 pounds heavier. My body fat was in the single digits. I felt good. My blood pressure wasn't bad. But when I went out of country with my son, and I was really regimented about the workout plan I had. I was always having to lift weights and lift heavy weights and I threw all that out the window. And as soon as I did that, all I focus on now is daily calisthenics, as well as some light cable exercises, as well as a couple days a week, some zone 2 cardio, which is along Peter Attia's kind of guideline for lifespan.
So let me have you pause there. So you said a lot, and like Peter T will say, let's unpack that.
Okay.
Because you had a lot of stuff. But using the Oura Ring, we both have one on. This does track sleep, and it tracks activity level, but it gives you a lot of information: body temperature, respiratory rate. Gives you a readiness score, a sleep score based on your REM and your deep sleep, and light sleep, and hours of sleep, sleep efficiency, and so much, and stuff like that. You also talk about sleep hygiene and how important that is. Keep the room cool, blackout curtains, keeping the EMF, electromagnetic fields, out of the bedroom, whether it's a TV, your modem, your phone. And if you need your phone by you, put it on, airplane mode. You've mentioned cutting out alcohol. I mean, alcohol consumption skyrocketed, I think, during the pandemic, and I think it's continued for a lot of people. And I think keeping that in moderation is a challenge. But to give it up completely, and 15 pounds, I think earlier you mentioned maybe even a little bit more, and as a result, your blood pressure normalized.
Yeah.
But yeah, here's a patient who, really not just exercise, but lifestyle is so important, and that you emphasize that so much, and that yet not finding the results you really wanted with regard to blood pressure and blood sugar and cholesterol, and really now tightening all that up by just making some simple changes.
Yeah, really, it's really creating a plan and really sticking to it that's not too complex, because there's a lot of supplements you can take. There's a lot of prescriptions you can take, which I think are, for me, are garbage. And there's definitely, I think some of the supplements you suggested, I've actually stuck with a core, and I have a whole cabinet full of stuff that's just going to get thrown out. And prescriptions, half of the prescriptions that people take probably don't need them if you really are taking care of the undercore of your lifestyle and intake. So it's like, yeah, you should have goals that you're trying to hit, and like people want to lose weight. That's obviously a good thing to do, because there's an obesity problem in this country. But really, just take a step back and focus on day to day. And I have people all the time asking what kind of diet. I'm like, it's not a diet, it's a lifestyle choice. And if you want to make those choices, they work. And if you don't, then you're not gonna get the results you're looking for.
That's right. Yeah, and I like the fact you said, 80% of your diet is whole foods. Shopping on the perimeter of the grocery store. I had a patient just talked recently, lost 20 pounds just by cutting out sugar.
Yeah.
And how much sugar we have in our diet. That's gone up 50-fold since the early 1900s. So that's a big thing, But you're right, lifestyle and making changes is so important. So my goal is to have patients just like you come on and maybe start this little podcast about what people have done and what changes they've made in their life that have really had an impact on their lab results, blood pressure, sleep, weight, energy levels. I mean, all these things become a byproduct of these changes or lifestyle choices.
Yeah, absolutely. And it's an ever fluid game. You think you know everything, and then you have blind spots, and that's kind of where I was. I thought I knew everything, and I clearly didn't. And so it's always making adjustments, and that like the Oura Ring was driving me crazy, and I actually have a Garmin that does kind of the same thing, and not relying too much on those stats, but following general guidelines, and don't make it overcomplicated. So keep things simple. And the other thing is also, we talked about breathing techniques, and that we had talked about Wim Hof breathing, and that's one thing I think has been a huge game changer as well, because it's not just what you're eating and what you're doing from a movement standpoint, but it's also making sure you're oxygenating yourself correctly.
Yeah. For those of you who don't know Wim Hof, he's the Iceman, and he has a breathing technique which is almost like hyperventilating and then breath holding, but it takes maybe 5 to 20 minutes a day, and some people really find it helps to calm down, parasympathetic tone, and calms people down. So, Glenn, I don't know if there's anything else you wanted to add.
No,
you can wrap it up, but this has been great. I really appreciate you taking time out of your schedule to come and visit with us, and we'll be sharing this on social media, and hopefully we can get a little bit of traction to what people can maybe learn about living a healthy lifestyle.
Awesome. Well, I would love to help in any way I can.
All right, Glenn. Thank you. Thank you very much.